There's been some amazing advancements in breast imaging, as an example, in both traditional methods as well as new technology that's been developed. These advancements can help improve the early diagnosis of breast cancer, and by diagnosing breast cancer earlier, hopefully it can improve clinical outcomes and also make the treatments that have to be utilized a little bit less invasive and more easy for the woman to tolerate. Breast cancer is an incredibly important disease. It'll affect up to 1 in 8 women in their lifetime. It's been estimated that as the population grows a bit older, that the women who are age 40 to 45 will increase by about 85% across the next decade in this country. And that means that the number of women who have breast cancer diagnosed in the United States could increase by 50% by the year 2030. This implies that early detection is even more important in improving clinical outcomes. I'm pleased that Decatur Memorial Hospital has invested so much in addressing this very important women's health issue. In today's day and age, where we're really working hard to personalize healthcare and treat each patient as the individual they are, it's really important to kind of understand what are their risks for having breast cancer, which of course is what we're talking about right now. How is that done here?
Well, we stratify our women in 2 ways. One way is their genetically inherent risk, and the other way is their breast density. So every woman who comes into the DMH Women's Center gets a genetic questionnaire. It's based on the Gale model. From that, we are able to stratify women as to either low risk, high risk, or unusually high risk. And then based on that, paired with their glandular density, we have different screening programs for those women.
You have an incredible spectrum of potential imaging diagnostics that you can do. You're going to use different imaging modalities, I assume, depending on what their risk factors are. How is that stratified?
Personalizing the healthcare by stratifying these women and then using different tools to detect breast cancer is what we've tried to do here. I think people don't realize that mammography is a very good tool for a certain population of patients. So it's very good in an average risk patient with fatty replaced breasts. And so that's what we use in that particular group of patients. But if somebody has a glandular density that is dense or extremely dense, mammography only finds half of the cancers. So to not do some form of supplemental imaging in that population is just wrong. And here at DMH, we're able to provide both tomosynthesis as a mechanism to image those women and ABUS, the automated breast ultrasound.
So would you describe, we have a young lady who has very dense breasts, and we have a couple of examples here. Do you want to speak to what we're seeing here?
Sure. Well, the image on the left monitor here, that's a mammogram, and you can see the whiteness is the glandular tissue. And in looking at that, breast cancers tend to be white as well. And seeing a white abnormality in the background of a white background is virtually impossible in that population of women. And on the right there, that's an ultrasound. It's a snapshot of our automated breast ultrasound. And there you can see a mass that was measured. It's about 6 millimeters to a centimeter in size, and we just can't see it. Even in retrospect, looking at the mammogram, we can't see it. The one thing that hasn't changed is women need to get screened, and early detection leads to better outcomes. And in this particular case, if we didn't have automated breast ultrasound, she would have waited another year. It would have grown for another year. It could have become palpable. She could have started to feel it and come back to the mammogram center to get evaluated after it had grown to a point that you could feel it. We're trying to get ahead of that game. We don't want women presenting when they've felt something. We want to be able to find it before they're feeling it.